like to thank organizers for giving me opportunity to present our work. My name is Hatice Osmanbeyoglu. I'm an assistant professor at University of Pittsburgh. Today I'm going to talk about our recent work on spatial landscape of malignant mesothelioma tumor immune microenvironment. Malignant mesothelioma is a very aggressive, rare cancer with very limited therapeutic options. It is a cancer of lung lining, pleural, as well as abdomen, peritoneum. And the main risk factor is asbestos exposure. 85% of the cases are malignant pleural mesothelioma, and around 15% of the cases are peritoneal mesothelioma. When we look at the 5-year survival rate, for pleural mesothelioma, it is just 12%. For peritoneal mesothelioma, it is on the order of like 65% due to effective surgical procedures. When we look at the genomic landscape of peritoneal and pleural mesothelioma, we don't see high frequency of activating mutations, which limits the options for targeted therapies. But there is high alterations in the tumor suppressor genes, including BAP1, NF2, and CDK, and this is for both peritoneal and pleural mesothelioma. Like around 5 years ago, FDA approved immunotherapy for pleural mesothelioma. It showed effectiveness around like 15% of patients, but we don't have any reliable markers to show which patients are going to respond to therapy. We performed a transcriptomic and genomic analysis before and show BAF1 alteration is associated with inflamed tumor microenvironment, but this was from the bulk data. Actually, there were other studies showing the similar trend from the other groups as well. To better characterize the immune tumor microenvironment, initially we performed as data generation using multiplex immunofluorescence imaging. As I mentioned, this is a very rare cancer. We received tumor microarrays from 3 different institutions. And in this tumor microarrays, we have samples like 6 micron diameter for patients, around like 115 patients. And for most of the patients, we have like 3 representative cores. So we use 2 different panels. In the first panel, we have more immune cell type markers, such as CD20 for B cells, CD8 for cytotoxic T cells, CD16 for macrophages. In the second panel, we use these tumor suppressor genes, and we try to detect their protein level. After generating this data, we try to characterize this immune tumor landscape and compare peritoneal and pleural mesothelioma and ask whether there is any differences. First, we checked whether cell type density correlations within patients, across patients, are different. Of course, we saw like there is a higher correlation of cell type types within samples from multiple cores. But you can see there is a high range of correlation values. Some of them are highly correlated, some of them are low. Then we perform an entropy analysis when I ask like whether patients have more heterogeneity, has better or worse survival. Here I am summarizing the result with this Kaplan-Meier curve. The blue ones showing the patients which has higher intratumor heterogeneity, yellow is the lower one, and surprisingly we find that patients with higher intratumor heterogeneity show overall better survival, which is different than the other most of the other cancer types. Then we ask whether cell type proportions are similar or different between peritoneal and pleural mesothelioma. Here I am summarizing the results. In this waterfall plot, every column represents one patient and a different color represents different cell types. For example, CD8s are like red and macrophages are yellow. When we look at on average, Pleural and peritoneal mesothelioma has similar cell type proportions, but we see elevated proportions of CD8 cells in pleural mesothelioma, this red bar chart, and in peritoneal mesothelioma we see like a little bit elevated of macrophages. As you know, for the therapeutic response, it is very important to see whether tumor cells are interacting with immune cells, especially for immunotherapy. So we ask whether there is any differences between pleural and peritoneal mesothelioma in terms of this cell-cell interactions, tumor and immune cell interactions. And we observed, I'm just summarizing the result in this box plot, and we observed higher tumor cell immune cell interaction contact score in pleural mesothelioma when we compare it to peritoneal mesothelioma. You can see this more clearly in these images of the cores. This is the H&E stained images for one pleural mesothelioma core, and this is the corresponding immunofluorescence imaging. The blue areas are the tumor cells, and you see the green ones are the like CD8 cells, macrophages, and you can say that like they are like more interacting. But when we look at the peritoneal mesothelioma, you see that the malignant cells indicated with this blue marker, they are more clustering together. So this was the main difference between pleural and peritoneal mesothelioma, which can have like therapeutic implications. Oh my God, what happened to this slide? So anyway, let me summarize this slide. One of our goals was like relating the tumor suppressor gene loss protein expression with the immune cell types. And here I'm just showing you one example with CD8 cell and BAF1 relationship. In this scatter plot, I'm showing you BAF1 intensity and CD8 T cell intensity. Every dot represents one patient, and you can see it is negatively correlated. When we do the cell-cell interaction analysis, we also saw that CD8 cell tumor cell contacts are higher when there is no like less BAF1 expression compared to when there is a BAF1 protein expression. You can see more clearly with these two samples. Like this one, patients showing higher BAF1 protein expression, and the blue cells are corresponding to tumor cells, so you can see they are clustering each other, so they are not contacting the other cells. But when there is a loss of BAF1, you can see that the blue cells are more mixed with the green tumor cells, immune cells. So then we could create, as a resource to community, the Human Spatial Atlas of Malignant Mesothelioma, where you can go and check H&E stained images, immunofluorescent images for each marker, as well as clinical features. And we did make this publicly available. This is the largest analysis of mesothelioma, which is a very rare cancer, provided by multiplex immunofluorescence imaging. And as a next step, we want to understand the molecular characteristics. So currently we are generating spatial transcriptomic and proteomic data to better characterize the molecular features of mesothelioma. Today, I'm just showing the subset of our analysis. If you are curious, you can check our recent publications, which is become available last week. With that, I want to thank you all for listening, and I want to acknowledge people who actually did this work. Sojun, David, and Elena take the initiative of analyzing this data. I also want to thank all our collaborators. Thank you.
Thanks for the talk. Nice resource. So you see this negative correlation between CD8 T cell infiltration and BAP1 expression. I don't know much about BAP1. Do you have any ideas of the mechanisms that could explain this?
So BAP1 is a chromatin modifier. So it is affecting many different genes. Also, it might have also a role in DNA damage response. But currently we don't know the mechanism. That is the reason that we want to generate this spatial proteomic and transcriptomic data together to like go more deep into like what is happening when BAP1 loss in the tumor cells. Maybe it's secreting like some cytokines and attracting the CD8 cells. So we want to study this more detailed after generating the data.
Is BAP1 frequently lost
Yes,
genomically?
yes.
Okay. Thank you.